wanted to ask a couple of questions now about you and your choice of career. And first up, what really influenced your decision of specialty?
So I actually fell in love with obstetrics and gynaecology when I was a medical student. I didn't expect to at all, but what really captured the imagination was firstly the mix between medicine and medications and the ability to operate and perform surgery. So to actually cure someone, which was always something that I wanted to do. But then also, I really was fascinated by pregnancy. It's a one specialty in medicine where you've got two patients, as it were, for the price of one. And I just could not get my head around it. I just thought it was amazing. And I still do, actually, 20 years later, believe it, over 20 years later. So it was a no-brainer for me once I actually touched. So that medical student experience, that 9-week block that I had in the year 2K, believe it or not, was the foundation, and it set my mind to go into obstetrics and gynaecology. You do need to look at the practicalities of the specialty. I don't think I really did. I chose my specialty because I love the subject. You do need to look at things like on-calls, lifestyle, litigation, and they just fell away for me at the time. I just loved the specialty too much. So again, my advice to prospective doctors would be, when you're considering your specialty, yes, think about the subject and what you love doing, but do also consider whether you'll have to come in at 3 a.m. to the hospital when you're 40 or 50 with children. And do think about whether it's quite a litigious subject area. But increasingly, I would say, actually, most areas of medicine are. So just think about what your key factors are before deciding what specialty you want to go into, because it's for the rest of your life. You can change, but it's a little bit tougher once you've gone down that path, that's all.
That's great. That was actually my next question. What advice would you give to students thinking of that, career in obstetrics and gynecology? So that's great. So one last question, if I may, on obstetrics and gynecology. Which areas do you think warrant increased attention and awareness in the future?
Oh gosh, this is really easy. So I would have to say that prevention of health problems. I don't think that we spend enough time on this. So our health in our early 20s, mid 20s, then dictates what problems that we go on to develop. And in fact, this very morning, I've just been writing an article on smoking and the impact that it can have on developing cervical cancer later on. So there are some modifiable things that we can look at, including our weight, our lifestyle, the amount of stress that we're going through, the late nights, how much we're drinking, smoking. All of those basic, boring almost things can then impact on our fertility, our periods, our cancer risk. So prevention, to me, is the biggest factor that we don't tap into as medics. And I think the next decade, we really need to home in on that. And one of the problems we have is within medicine, as a student, you're so busy learning about treating problems that you don't spend enough time thinking about how to prevent them developing in the first place. And so that, in a nutshell, to me, would be the key thing in terms of moving forward. And just coming back, if I may, to the bit about careers advice for medical students. My biggest piece of advice would be to really savour the flavour of the specialty you're going into. And we know that as a medical student, you don't spend very much time in any specialty. So don't go and take time out as a junior doctor. Your circumstances may have changed by then. You can do an S3 year, for example, or do a year in the specialty that you want to do before deciding if you're not sure. And think about all the different factors that are important to you. Lifestyle may not be important now, but in 5-10 years' time, if you want a family, it will be. So various different factors. Get an in-depth flavour and understanding of what you're signing up for, because you're looking at about 40 years worth of service in that specialty once you do decide.